In this class, we are going to discuss about morphology of insect head and its appendages. Insect head segments. The insect head is a strongly sclerotized capsule called cranium. Insect head is composed of a series of segments. It consists of non-segmented acron, preoral plus 6 segments, postoral. These 6 segments are 1. Labral, 2. Antennal, 3. Intercalary, 4. Mandibular, 5. Maxillary, 6. Labial. First 3 segments appear only during embryogenesis and disappear later. The last 3 segments are easy to observe in all stages of development, mandibular, maxillary, and labial, because they bear appendages. Acron is not considered as a true segment because it lacks appendages. So only 6 segments are true segments. Head is the sensory and feeding center. It bears a pair of antennae, a pair of compound eyes, organs of vision, 3 simple eyes or dorsal ocelli, which may be present or absent, and mouthparts. Internally, it has brain. Structure of a generalized insect head. Insect head capsule or cranium is divided into various regions or areas, sclerals, by a number of sutures or sulci. Head of immature insects nearly always have a line along the dorsal midline of the head dividing into 2 lines on the face so as to form an inverted Y. This is not a groove but simply a line of weakness, along which the cuticle splits when the insect molts. It is therefore called ecdysial cleavage line, but has commonly been referred as epicranial suture. This cleavage line is rarely retained in adult stage. Sclerite areas or regions of the head. Frons. It is the front portion of the head. Gena. It is the region on either side of frons below the compound eye, also called cheek. Vertex. It is the region above the frons and between compound eyes. Clypeus. It is a plate-like structure above the labrum or below the frons. Subgena. This is the sclerite area found below the gena. Occiput and postgena. These are the tiny sclerites lies in front of post-occipital suture. Occiput is a region between occipital and post-occipital suture. Sulci and sutures of the head. Epicranial suture or ecdysial line. It is an inverted Y-shaped suture found medially on the top of head, with a median suture, coronal suture, and lateral sutures, frontal sutures. Epistomal sutures, also called frontoclypeal sulci. It is found between frons and clypeus. Occipital sulcus. This separates occiput from vertex. Post-occipital suture. It divides occiput from post-occiput. This line indicates the fusion of maxillary and labial segments. Other groves/sulcus include circumocular sulcus or circumantennal sulcus, which surrounds eyes and antennae, respectively. The posterior opening of the cranium or head capsule is called occipital foramen, through which the alimentary canal, nerve card, and some muscles pass into the thorax. The insect's neck is known as the cervix. This is a membranous area. As a result, it allows considerable freedom of movement for protraction and retraction of the insect's head. Tentorium, endoskeleton of head. The cuticle forms an arm-like inflections at 4 points on the cranium. Internally, these inflections join or meet, forming an internal skeleton called tentorium. These internal inflections are represented outside by depressions and are called tentorial pits. There are 2 anterior and 2 posterior tentorial pits. The tentorium consists of a tentorial bridge and paired anterior arms and paired posterior or dorsal arms. Apodeme. Functions. The tentorium provides rigidity to the head capsule. 2. It gives point for attachment muscles. 3. It also provides supports for the internal organs like brain and part of foregut, a part of alimentary canal that passes through head.